Hi guys, welcome back to Dr. His Academy. Today we'll be discussing spirometry, where we'll discuss everything about lung volumes and capacities. Stay tuned. So the volume of air in your lungs and then the volume of air which you take in and take out at every moment in time is dependent on what your lung tissues, as well as your chest wall and your respiratory muscles. So if there's any pathology or any disease in any of these, it will affect what the lung volumes. And then the capacities is derived from two or more lung volumes combined together. So we are going to look at the various lung volumes and capacities. The first one we'll be looking at is what the tidal volume. All right. So the tidal volume is the volume of air you inspire or expire during normal breathing. So when you're just resting, sitting on the beach, and then taking in air and then breathing out, you breathe in tidal volume and then breathe out tidal volume as well, right? So looking at the graph over here, this is calibrated in mils, and then this can be calibrated in time, right? So you take in what tidal volume, right? And then you breathe out tidal volume as well, right? So this would be the inspired tidal volume, and then this would be the expired tidal volume. So the tidal volume is an average of what? 500 mils. So you take in 500 mils and then take out what? 500 mils. That's the tidal volume. Now, the next one we have is what? The inspiratory reserve volume. Okay. Now, for the inspiratory reserve volume, remember that we've taken our tidal volume inspiratory, like inspired tidal volume. And then inspiratory reserve volume is now when you breathe in normally, you cannot take in extra amount of air. Okay, so it's the maximum amount of air you can breathe in afterwards normal inspiration, right? So we have something like from here, that's from the end of tidal volume to what here, okay? That's your what? Inspiratory reserve volume. So from here down is about how many mils? 3,000 mils. So your inspiratory reserve volume is about what? 3,000 mils, right? Now let's expire back to where? The beginning of your tidal volume, right? So we've expired out the air which you took in, right? Now the tidal volume expiratory, right? So what's the next volume we'll discuss? The next volume we'll discuss is what? The expiratory reserve volume. And then the expiratory reserve volume is the maximum amount of air you can expire. So the maximum amount of air you can breathe out after what? Normal expiration. Okay, so after you breathe out, you can now breathe out further to remove all the air from your lungs. Okay, actually, you cannot remove all the air. Okay, but then the ones you can remove, the maximum you can remove after normal expiration is what? Expiratory reserve volume. Okay, so we have our expiratory reserve volume down here. So it's about 1,200 mils. 1,200 mils. Okay. And now there is a particular amount of air which you cannot remove no matter how hard you try. Okay, that's the what? Residual volume. Okay, so is the residual volume or the amount of air that is remaining in the lungs after maximum expiration. Okay, so you can't remove this one out. That's what from here to point zero, right? So this point zero from here to point zero. That's 1,200 mils. All right. Now, as a brief recap, the tidal volume is the amount of air you breathe in and breathe out during what? Normal breathing. Now, the inspiratory reserved volume is the maximum amount of air you can inspire after what? Normal inspiration. Okay? And then the expiratory reserved volume is the amount of air, maximum amount of air you can expire after what? Normal expiration. Okay? So the residual volume is now what is left after what? Maximum expiration. Pretty easy, right? Let's talk about the capacities. So a capacity is when you add two or more what? Long volumes together. You get a what? A capacity. Okay? Before then, we've said our tidal volume is what? 500 mils. Inspiratory reserve volume is what? Can you help me? 3,000, right? And then the expiratory reserve volume is what? 1, 2. And the residual volume is what? 1, 2. All in mils, right? Capacity, like I told you, is when you join two or more long volumes together, right? Let's talk about what? The inspiratory capacity, all right? The inspiratory capacity is, remember this was our what? Inspiratory reserve volume, all right? Inspiratory reserve volume. And this was our what? Tidal volume. So when you add the inspiratory reserve volume and the tidal volume, you get what? Inspiratory capacity. So inspiratory capacity is what? The maximum amount of air you can inspire after what? Normal expiration. Okay, so this is your normal expiration, like this baseline here. This baseline here is your normal expiration. Okay, and then the maximum amount of air you can inspire after normal expiration, that's from here to here. That's your tidal volume plus what? Inspiratory reserve volume is what? Inspiratory capacity. Okay, that's your tidal volume plus what? Inspiratory reserve volume. Don't worry, let I'll show you a trick which you can use to what? Get these capacities. Okay. Now, the next one we'll talk about is what? Expiratory capacity. So expiratory capacity is what? This is the expiratory reserve volume. Expiratory capacity is what? Expiratory reserve volume plus what? Tidal volume. Right. So expiratory capacity is after you breathe in normally, that's here. After you breathe in normally, the maximum amount of air you can breathe out after you breathe in normally, okay, is your what? Expiratory capacity. All right. So that will be your tidal volume over here plus what? Expiratory reserved volume. Right? That's your what? Expiratory capacity. So after you've breathed in normally, after normal inspiration, you want to check how able you are to push out two volumes together. So you push out what? The tidal volume and what? Expiratory reserve volume. All right. Now the next capacity we'll look at is what? Functional residual capacity. And the functional residual capacity is the amount of air that is remaining after what? Normal expiration. Okay. So if from the word functional, physiological, and then residual, residue. So in a normal person that is not having any form of respiratory issues, okay, that is not hyperventilating or stuff like that, okay, normal person that is breathing in and out normally, after the person breathes out, there's a capacity that is remaining in the lungs. That's your what? Expiratory reserve volume, which can still be forcefully removed. But for now, we are calculating capacities, right? So expiratory volume and what? Residual volume. That's your what? Functional residual capacity. All right? So your expiratory reserve volume and what? Residual volume. All right? We're progressing, right? And then another one we'll discuss is what? Vital capacity. Okay. Now your vital capacity is a measurement of what? Three volumes, right? So vital capacity measures what? Inspiratory reserve volume, tidal volume, and what? Expiratory reserve volume. Okay. So the vital capacity is what? The maximum amount of air you can breathe in after what? Maximal expiration. Okay, so it measures how able you are to breathe into the fullest and breathe out to the what? Fullest. Okay, so that's your what? Expiratory reserve volume plus your what? Tidal volume plus your what? Inspiratory reserve volume. All right, we're almost done. The last one we should be discussing is what? Total lung capacity. And now the total lung capacity is a measure of what? Everything. All right, so that's your what? Inspiratory reserve volume, tidal volume, expiratory reserve volume, and what's residual volume. Okay. Now, using these various volumes, let's get the figures of the capacity. Inspiratory capacity is equal to what? Tidal volume, which is what? 500 plus inspiratory reserve volume, which is what? 3000. So to be what? 3500. Right? Now, the expiratory capacity is what? Tidal volume plus what? Expiratory reserve volume, which is 1, 2. That will give us what? 1700. Then the functional residual capacity is equal to what? Expiratory reserve volume, which is what? 1, 2, plus what? Residual volume, which is what? 1, 2, to give what? 2, 4. Right? And then the vital capacity is what? Expiratory reserve volume, which is what? 1, 2, plus tidal volume, which is what? 500, plus what? Inspiratory reserve volume, which is what? 3000, equals what? 1, 2 plus 500, that's 1, 7, plus 3000, that's what? 4, 7. Right? Hope I'm correct. Yeah. Then the total lung capacity is now all the four of them together, right? So that's your what? Inspiratory reserve volume, that's 3000, plus tidal volume, which is what? 500, plus expiratory reserve volume, which is what? 1, 2, plus residual volume, which is what? 1, 2, to give what? 3, 5, 2, 4. 3, 5 plus 2, 4, that's what? So 5, 9 what? Males. Alright? Now, these are your various capacities. I told you I'll show you a trick which you can use to get all the volumes and capacities, okay? A simple trick I want to show you, which you can use for each of them, each of the capacities, is what? REIT. Okay? REIT, rates. And then beside E here, you put what? T again. So you take your R and E, that's your what? Residual volume and what? Expiratory reserve volume. You can hear residual, right? So that will give you what? Functional residual capacity. I'm sure you heard residual. As residual volume and expiratory reserve volume to give you what? Functional residual capacity. Then you take your what? Inspiratory reserve volume and tidal volume. You heard inspiratory, right? Yeah. That would give you what? Inspiratory capacity. So that will give you what? Inspiratory capacity. All right, that's pretty easy, right? Next one is what? You take your E and take your T. Okay, right? That's your E and T. That's your expiratory reserve volume and your what? Tidal volume. To give you what? I'm sure you heard expiratory reserve volume, so you're expecting what? Expiratory capacity. All right, and then the last one, but not the least, is what? You're taking everything in the middle. So you're removing just this last two, up and down. And then you're taking 1, 2, 3. Okay? To give you what? Vital capacity. That's your expiratory reserve volume, tidal volume, and what? Inspiratory reserve volume. Then I'm sure you obviously know your total lung capacity, which is what? A combination of all four volumes. So in order to measure these volumes, we use what? An instrument. This is the instrument over here called what? Spirometer. Right? So this is the instrument called spirometer. This is the tube and this is the device itself, right? So the patient puts the tube in the mouth and then breathes in and breathes out. So they use these calibrations to measure what? the volume of air. Okay, so they've measured what expiratory reserve volume, tidal volume, inspiratory reserve volume, but they don't measure one, which is what residual volume. All right, it cannot measure what residual volume. Okay, because the residual volume is what remains in the lungs. Right, so you cannot breathe out the residual volume for this device to detect. All right, now scientists have found a way of measuring this residual volume from what? Measuring the functional residual capacity. And then from the functional residual capacity, since they know that functional residual capacity is what residual volume plus expiratory reserve volume, they'll measure this and then subtract the expiratory reserve volume. Okay, and then that would give them what? The residual volume. How do they measure it? There are two major methods they use. One is what? Helium dilution method. In helium dilution method, they basically put what? Helium gas inside here. I know helium gas cannot be what? Absorbed by the capillaries of the lungs, okay? And then whatever is breathed in can be breathed out into this device, right? So the person puts this device in his or her mouth and then keeps on breathing in and breathing out for a number of times, all right? And then afterwards, the concentration here in the device and the concentration in the lungs will be what? The same thing because none is absorbed into the blood, right? Now, after some time, as the patient continues and then breathes out, after breathing out, they will now measure what? The amount of gas here after breathing out into this device and then subtract it from what? The initial concentration. That will give us what is left inside the lungs, right? Yeah. So the other method they use is what? Body plethysmography. So this body plethysmography uses a device known as plethysmograph, right? And then it works on the principle of what? Boyle's law, which says that the pressure is inversely proportional to the volume, right? Let me show you what happens in what two major lung diseases, restrictive and what? Obstructive. So this is a normal, this is normal. And then for the normal, you breathe in your what? Tidal volume, and then you can now take in what? Inspiratory reserved volume. And remember, from your tidal volume, you can maximally breathe out what's expiratory reserved volume. And what is left in the lungs afterwards is what? Residual volume. Right? Now, in restrictive lung disease, there's some sort of what? Restriction to what? Lung expansion. And then a typical example is what? Pulmonary fibrosis, where there's what? Fibrosis of the lung tissue. All right. And then in restrictive lung disease, what happens? Everything is reduced. So inspiratory reserve volume is what? Reduced. Tidal volume is what? Reduced. Inspiratory reserve volume is what? Reduced. Then residual volume is what? Reduced. So because of the fibrosis, the lung cannot expand to take in what? So much air. And then all your lung volumes are what? Decreased. Okay? In your obstructive lung disease, example what? COPD, there can be what? A narrowing of the what? Airway, right? And then the person can breathe in normally, but cannot what? Breathe out normally. Why? When you are breathing in, what happens? You're expanding the chest wall. Okay, so this is the chest wall. This is the chest wall. Is what's expanding, and then when it's expanding, what happens? There's a traction on the what? Airways, and this traction now pulls it open very well. Okay, allowing air to enter. Right. However, when you're breathing out, what happens? Your chest wall is what? Recoiling. Okay, so your chest wall is what? Recoiling, and there is no traction on this airway. Instead, your airway is recoiling as well. All right. So there's some sort of recoil, and then which takes the airway down, right? So in COPD, there would have been a normal obstruction, right? So let's assume you had an obstruction which was this way, right? Had an obstruction which was this way. When you recoil the chest wall, there is now a narrower what caliber of airway. But in this case, when you expanded it, this stuff, that's the obstruction, would have still been there. But then, since there's what expansion of the airway, it will not be felt by the individual, right? So the individual can breathe in normally, but cannot breathe out normally. So the person will have difficulty breathing out. So breathe out little amount of air, but can breathe in a normal amount of air, right? This can eventually lead to something called a barrel chest, where there's now what's usually seen in people with COPD, okay, over a long period of time, where the chest wall is now what's overly expanded. Like normally, it's in expanded state because you would have been taking in air and then air keeps on what's accumulating in your what lungs, right? So in COPD, what I'm expecting, respiratory reserve volume is what normal, right? Because the person can inspire normally, right? Tidal volume is what normal because the person can inspire normally, right? And then expiratory reserve volume is what decreased because the person cannot what breathe out well. And then the residual volume eventually is what increased. Why is it increased? I've told you because one, the person cannot what breathe out fine. Okay, the person cannot breathe out well. And then the expiratory reserve volume would have what been reduced due to what accumulation of air in the lungs. Also, the tidal volume, which was normal, the inspiratory tidal volume is normal. Expiratory tidal volume, well, it's not so normal. It's a little lesser, right, than the normal. So, guys, we've come to the end of this lecture. I hope you enjoyed it. Do well to subscribe, put your comments below, like and share to your friends so they can benefit from this lecture. Thank you and see you in the next lecture.